I want to start today's video with a quiet truth. A truth that most people don't realize until it's too late. There is a cancer that doesn't shout, it whispers. And by the time most people notice it, it's already stolen too much. I'm talking about pancreatic cancer, a silent killer that takes hundreds of thousands of lives every year, often without warning. But what if I told you that in some cases, there are warning signs, subtle, quiet, even confusing, but real. And if you're over 60, these signs might show up in your body months before diagnosis. Today, I'll walk you through 7 early symptoms that can signal pancreatic cancer when it's still treatable. When you still have time, this may be the most important video you watch all year. So please don't skip ahead. If even one of these signs feels familiar to you, or someone you love, I want you to take it seriously. We're not here to create fear. We're here to bring hope through early awareness. Because when it comes to pancreatic cancer, time is everything. Let's begin. Symptom 1. Digestive issues that won't go away. You might think it's just gas, a bit of bloating, maybe some indigestion after eating. But when it happens every day, when food just sits in your stomach, when you start noticing greasy or floating stools, or even mild nausea with no clear cause, that's not normal digestion. You see, the pancreas plays a crucial role in breaking down food. It produces enzymes that help digest fats and proteins. But if there's a tumor, even a small one, those enzymes don't reach your stomach properly. The result? Greasy stools that float, a heavy bloated stomach after meals, unexplained weight loss even though you're eating, or a sudden intolerance to fatty foods. Doctors sometimes miss this because it looks like IBS or acid reflux, but in patients over 60, especially if these symptoms are new or persistent, they may be the first sign of pancreatic issues. Symptom 2. Fatigue that feels like you're carrying cement. We all get tired, but this isn't ordinary tiredness. This is bone-deep exhaustion, the kind where getting out of bed feels like lifting weights, where no amount of rest helps. Why does it happen? Because cancer, even in early stages, steals energy. It uses nutrients meant for your body. It affects digestion, sleep, and even your hormones. For some patients, this profound weakness is the first clue. They say, I used to walk to the park. Now I struggle with stairs. I sleep 9 hours and still wake up tired. If you feel this type of fatigue for more than 2 weeks, and it's new, don't ignore it. Get your blood tested, talk to your doctor, and mention that you want your pancreas checked too. Symptom 3. Strange fevers that come and go. This one surprises people. Pancreatic cancer doesn't usually cause a high fever, but in the early stages, you might feel slight chills at night, a mild fever that comes and goes, episodes of sweating for no reason. Why? Because tumors near the bile ducts can cause inflammation, and inflammation leads to fever spikes, especially in the evening. If you've had nights where you sweat through your clothes, or wake up shivering with no flu or infection, that's a red flag, especially if it happens along with fatigue or digestive issues. Symptom 4. Unexplained blood clots. Now this is a very serious warning sign. If you or someone you know suddenly gets pain and swelling in the leg, redness or warmth in one calf, or unexplained shortness of breath, it might be a blood clot. And yes, pancreatic cancer is known to cause clotting problems. Even before the tumor is found, the cancer cells can trigger clot formation in veins or lungs. This is called Trousseau's sign, and it's one of the earliest pancreatic clues. If you're over 60 and experience sudden leg swelling, don't wait. Ask for an ultrasound, get a D-dimer test, and make sure they check beyond just the heart and lungs, because a hidden tumor could be the reason. Symptom 5. Constant bloating that feels unnatural. This one is often mistaken for gas or diet issues, but bloating from pancreatic issues feels different. Patients describe it as tightness in the belly even without food, pressure that doesn't go away, like something is pushing from the inside. Why does it happen? Because the tumor may be pressing on nearby organs or causing fluid buildup around the stomach and liver. If bloating persists daily for weeks, with or without eating, and especially if paired with nausea or weight loss, it's not normal aging. You need imaging. A CT or ultrasound can help rule it out. In the next part, we'll cover how your urine color could warn you weeks before diagnosis, a surprising organ that swells silently as a clue, the daily symptoms that most people ignore, and how to talk to your doctor so they don't dismiss these signs. This is not just another senior health video. This might save a life, maybe yours or someone you love. So stay with me. And if you've related to even one of these signs, don't panic, just act. Early. In the last part, we uncovered some of the earliest signs, the signs that pancreatic cancer quietly leaves in your body, if you know how to listen. From unusual digestive discomfort, to unexplained fatigue, to strange fevers and clotting issues, each one matters. But we're not done. There are two more signs that doctors sometimes miss. They show up in the bathroom, or even during a simple ultrasound, and they might be your earliest chance to stop something dangerous in its tracks. Let's begin. Let me ask you something. Have you ever looked at your urine and thought, that's darker than usual? Maybe it looked brown, maybe deep yellow, like syrup. And no, it wasn't because you were dehydrated. If so, your body might have been giving you a quiet alarm, because dark-colored urine, especially with no change in water intake, can be an early sign of jaundice. And here's why that matters. When the bile duct is blocked by a tumor in the pancreas, bilirubin, the yellowish pigment your liver makes, starts building up in your blood. And guess where it first shows up? Not in your skin, not in your eyes, but in your urine. This can happen weeks before the eyes turn yellow, and months before more serious symptoms appear. So if your urine has suddenly turned darker, if it smells stronger, or looks brown or tea-colored, and there's no UTI or dehydration to blame, that's not something to ignore. It could be your first chance at catching a hidden tumor early. Ask for a liver function test, and make sure they check your pancreas too. Now here's another sign that's almost never talked about. You go for a scan, maybe an ultrasound or a CT for something else, and the doctor says, "We noticed your gallbladder's enlarged." Or, "There's some swelling around the liver." You feel fine, no pain, no major complaints. But swelling? That, my friend, might be your second warning. You see, the head of the pancreas sits right next to the bile duct and gallbladder. If a tumor forms there, it can silently block the flow of bile. This causes bile to back up, swelling the gallbladder, enlarging the liver, even changing the texture of nearby tissue. And here's what most people don't realize. This can happen without any pain, no fever, no vomiting, no discomfort, just a scan result that says mild enlargement. In my years of practice, I've seen at least a dozen patients whose first sign of cancer was an ultrasound that showed an enlarged gallbladder. So if your doctor mentions this, even if they say, "Don't worry," ask why. Ask for follow-up imaging, and bring up the possibility of pancreatic involvement. You deserve answers and time. Now let's talk about something even more subtle, something people brush off every single day. Appetite changes. Yes, your appetite can be a clue. Some patients say, "Doctor, I'm just not hungry anymore." Or, "I eat half what I used to, and I feel full quickly." Others notice the opposite. They crave carbs, sweets, or greasy food. Or they feel slightly nauseated at the thought of meat or fat. And this isn't about dieting or preferences. It's about how the pancreas affects hormone balance, especially insulin and digestive enzymes. If your pancreas is under attack, your whole metabolism changes. You burn nutrients differently. You absorb less from food, and your body begins to lose weight, even when you're eating enough. This isn't normal aging. It's your body trying to adapt to something deeper. So pay attention. Is your appetite different than it was 3 months ago? Are you losing weight without trying? Do foods you once loved now make you nauseous? Track it. Write it down. And if you see a trend, talk to your doctor, because the sooner we act, the more options we have. Before we wrap up this part, I want to share something personal. Years ago, I had a patient named Margaret, a lovely 68-year-old woman, full of energy and life. She came in for something minor, bloating and fatigue, no pain, no fever, just off. I noticed her urine sample looked darker, and when I asked about her appetite, she said, "Now that you mention it, I haven't been eating much lately." We did an ultrasound. There it was, a small mass in the pancreas. Caught early. She underwent treatment. It wasn't easy, but today she's 74 and still walking her dog every morning. She caught it in time. That's why I'm sharing this video, so more people like Margaret get that chance. In our final part, I'll guide you through how to talk to your doctor so they take you seriously, what specific tests to request, and what daily habits you can adopt now to protect your pancreas. Because awareness isn't enough. Action is what saves lives. If you've made it this far, you're not just watching a video, you're protecting your future. You're listening to your body, and you're taking action. Now let's talk about exactly that, what you can do. If you've noticed even one of the symptoms we've discussed, digestive changes, unexplained fatigue, dark urine, blood clots, or a strange drop in appetite, please don't wait. Let me guide you step by step. The first thing I always recommend is this: keep a symptom journal. Yes, a simple notebook. Write down what you feel, when it happens, and how long it lasts. For example, nausea after breakfast lasted 20 minutes. Urine darker than usual started 3 days ago. Skipped lunch, no appetite. Woke up at 3 a.m., sweating, slight fever. These small notes become powerful evidence. They help your doctor spot patterns, and they help you trust what your body is telling you. Second, when you go see your doctor, ask clearly for these tests. A complete blood panel, including liver function and bilirubin levels, a CT scan or MRI of the abdomen, an abdominal ultrasound, especially if you've had bloating or dark urine, and in some cases, a CA 19-9 tumor marker test. Now, is CA 19-9 perfect? Number. But in combination with imaging and symptoms, it can provide a useful clue. And most importantly, if something feels off but your tests come back normal, don't stop there. Seek a second opinion. Ask to see a gastroenterologist or a pancreatic specialist. I've had patients with vague symptoms for months, and it took a third opinion to find the real issue. Your health is worth the extra time. Third, and this is key, let's talk prevention, because not every risk turns into cancer, but by making a few daily shifts, you can dramatically lower your risk. Let's start with diet. The pancreas thrives on clean, anti-inflammatory foods. That means more leafy greens, more berries and citrus for antioxidants, healthy fats like olive oil and avocado, and lean proteins like fish or plant-based sources. But just as important is what to limit. Processed meats like bacon, sausages, and salami. Refined sugars, yes, even that harmless tea sugar. fried foods which increase oxidative stress on your organs, and high alcohol consumption, which burdens the pancreas heavily. Even one drink a day over time can increase your risk. So be mindful. Now, a simple routine. I teach many of my senior patients. Start your morning with a glass of warm water and lemon. It helps your liver, stimulates gentle digestion, and encourages bile flow, which supports the pancreas. Then take a short 10-minute walk after breakfast. Nothing intense, just movement to get your metabolism going. And once a week, drink turmeric tea or ginger tea. Both have anti-inflammatory effects that benefit your gut and pancreas. These tiny steps over time can build incredible protection. Let's also talk about stress, because chronic stress affects your entire endocrine system, including the pancreas. Stress hormones like cortisol interfere with insulin production. They raise inflammation levels, and they alter your appetite and digestion. So here's my tip. Just 5 minutes of focused breathing in the morning, and again before bed, can lower your blood pressure, improve sleep, and indirectly support healthy pancreatic function. There's no expensive therapy required, just your breath and your time. Before I conclude, I want to speak directly to the caregivers, the daughters and sons, the husbands and wives, who are watching this for someone they love. If you've noticed changes in their appetite, if they're more tired than usual, if something just doesn't seem right, don't brush it off. Encourage them to talk about it. Book that appointment. Be their second voice when they're unsure, because you might be the reason they catch something just in time. So let me quickly recap what we've covered across these three parts: digestive distress, greasy stools, and early satiety, unexplained fatigue and fever spikes, blood clots with no clear reason, dark-colored urine and gallbladder or liver enlargement, loss of appetite, and strange food aversions, and the importance of imaging, journaling, and daily prevention. Each one is like a puzzle piece, and together they can reveal the bigger picture before it's too late. You have the power to catch illness early, you have the wisdom to listen to your body, and you have the support right here from this community. If you found this video helpful, please tap that like button. It tells the YouTube algorithm to spread this message further. Comment below with a heart if you're taking your health seriously, and subscribe for more doctor-backed tips to live stronger, longer, and wiser. This is Dr. John, wishing you peace, clarity, and a long life lived fully, one healthy step at a time.